Welcome and thank you for joining the Coronis Health webinar, How We Increased Revenue 150% for Two Unique Medical Practices. We are here today with Abby and Vince, who are two revenue cycle experts, and they are going to share all of our secrets, a step-by-step breakdown of strategies and action steps we have taken with two specific medical practices to show you guys how this can work. So Abby has over 10 years experience working in the healthcare industry. She is our VP of operations, and she definitely has extensive knowledge in therapy, mental health, behavioral health, and primary and specialty physicians. She's an expert at telehealth, telemedicine, and helped lead our COVID-19 task force, and she definitely understands the importance of managing the patient relationships. Vince has 18 years of experience in the healthcare industry, working mostly in receivables and process improvement. He has expertise setting up processes and training teams, both US and overseas, on numerous practice management softwares, workflow development, merchant account management, and internal and external operation resolutions. As our director of patient revenue, he definitely understands the importance of promoting client services and communications so that patients are happy and we can increase receivables. So without further ado, I will pass you over, and Abby and Vince, take it from here.
I'd like to first welcome everybody and thank you for taking the time out of your day to join us. As mentioned, I'm Vince Asbarty, Director of Patient Revenue with Coronis Health. So really like to go over some learning objectives with things that we can take away for today. So with what I'd want to, I'd want to talk a little bit about these objectives. So Coronis Health, we're a nationally revenue cycle management company working in almost every different healthcare specialty. So the information discussed today should directly impact you in some way, even if the case studies presented aren't particularly in your current specialty. So some learning objectives such as how to analyze your current patient statement process and better understand aspects of that statement process, timelines and inefficiency in the industry standard statement process, a breakdown of two practices on strategies and actions Coronis Health took to increase revenue, and then how to shift your patient statement process moving forward for the best outcome. I'm going to hand this over to Abby real quick, Vice President of Client Relations and Operations, to talk a little more.
Awesome, thanks, Vince. So like Risa and Vince both mentioned, we are Coronis Health. So here's a quick bio of both Vince and I. Risa did an amazing job of explaining kind of our background and where we come from. So one thing that we wanted to highlight before we kind of took a deep dive into the patient statement process were our service groups. And so the one unique part about Coronis Health is we are a national and global RCM company, and we work with various different specialties. Here are our various different verticals that we're currently working in. And the nice part about Coronis is we cover over 48 of the states in the United States and provide revenue cycle for those individuals, and then also cover all different types of specialty, from labs to hospitals to primary and specialty physician to EMS, etc. So like we were talking, the one unique thing about Coronis Health is we're bringing multiple years of industry knowledge to our practices. And so like you can see on this slide, we have 35 plus years of industry knowledge. With that, we have expertise that's kind of gone through the healthcare changes, from going from paper EHRs and paper documentation to the first EHR and moving into the computer settings, all the way through to kind of going through the pandemic and seeing how healthcare has pivoted during that time with technology. And one of the areas that we wanted to focus on today specifically was how we're managing patient statements and moving into more of a technologically savvy environment. But part of Coronis, we do provide all of the services below from front to end revenue cycle. So now I'm going to pass it over to Vince to further discuss current patient statements and what e-statements can look like compared to what your current process looks like.
Thanks, Abby. We wanted to take a minute just to show a typical industry standard statement process. We call it the drop it and forget it method to better understand the change that we are driving. Once a balance drops to a patient responsibility, in many cases there needs to be manual intervention in order to generate that statement, whether it be an individual statement or an actual statement file. Depending on your current practice statement process, that could be weekly or even monthly when that's being done. That statement then needs to be printed and mailed, which is adding roughly an additional 7 days. A timely insurance determination on a claim is typically 10 to 14 days. So that's where you can expect to get a payment or some kind of adjudication. So at that point, we are looking at best a patient has a statement in their hand in the 30-day max, which if you are anything like me, I've had a hard time remembering what I did last week. So when you're talking about an extra 30 days, a patient at that point can potentially be reaching out to the practice or the call center to understand the bill. I can assure you that the statement is going to probably sit on the kitchen table or get lost somewhere a few days prior to making that call as well. But let's just say everything goes smoothly and all is well. The patient agrees to pay, at which that mail process starts all over again, waiting for that payment to be delivered to a lockbox, PO box, or an office address. Then that payment gets cashed and manually posted. So at best, you're looking at a 45-day turnaround. So how is Coronis Health going to change this standard? Simply by utilizing technology. Coronis, with the help of our partners, brings visibility and transparency to all the patient revenue process and offers a click-to-pay option with patient-friendly e-notifications. With patient responsibility growing year after year, there is an untapped revenue stream that might be overlooked by your practice. As we just discussed, the timeline of a paper statement and recent consensus show that 90% of the organizations are still sending paper statements, and only 22% of those statements are resulting in payments. With patient collections contributing to roughly 30% of a group's revenue, and 60% of those said revenue is being billed out after the visit, you can see why Coronis is highly focused on optimizing revenue growth in this sector. The medical industry is one of the few industries that a person providing the services expects payment weeks after the service is provided. Due to this, Coronis Health wants to put a drop in and forget it days way behind us and focus on those overlooked potential revenue that is often neglected. With seamless integration, a day that the claim becomes patient responsibility, the software receives the balance and begins to initiate an e-notification. This notification is then delivered instantaneously and directly to the patient the next business day. With this time, from a claim being patient responsibility to a statement being in the patient's hand has already been minimized by 29 days. So what happens if the patient has a question? They can still call the call center. However, the software also provides a chat feature to which the patient can simply message back with a question via email, text, at their own convenience. Being that it's click to pay, we can receive payments within 48 hours of the claim balance becoming patient responsibility. These payments are then paid out to the bank account and payments auto-posted within the hour. They are received due to integration. If the streamline isn't enough to persuade you to do things differently, let me tack on a little extra tidbit here. We already discussed how, at best, through the paper statement process, it would take 30 days to reach a patient. And let's face it, many of our first statements are going to go ignored and probably tossed aside or thrown in the trash. This extends the billing cycle out another 30 days, thus pushing it well over that 60-day mark, when the patient would receive that second paper notification. With our setup, we can set multiple e-notifications by adjusting billing cycles and rules to send 9 notifications or more within a 30-day period. Reaching the patient more frequently and remind them of an open balance is just the best process. It's easy to ignore a notification once a month, especially one delivered by the mail. But an e-notification that comes directly to the device, the majority of people are going to look majority of the people are going to look at 50 times of the day. It's tough to ignore that. So as mentioned, we have a few case studies we'd like to go over. We'd like to show 2 unique different practices which we took the tools we recently discussed and put them into action. In this first case study, we had a practice whose patient aging was steadily on the incline. Previously using that typical drop it and forget it 30, 60, 90 paper statement cycle, their collection rate was not what we wanted to see. Coronis altered that patient statement process by introducing a heavy e-notification billing cycle we discussed previously. Within a 48-hour period, we had our process set up and implemented our plan of action. The first week, we went off like clockwork. However, the provider received multiple complaints regarding frequently messages and wanted to stop e-notifications. Mind you, even though we can alter the timing of these messages, we still felt our billing cycle was the best option to collect. So we got on a call and used this as a partnering opportunity. With the office manager, we worked together to train the front staff on how to inform patients of e-notifications and better explain how that process would work. We also took that time to discuss potential billing cycle revenue changes we could implement with a provider. When we provided the statistics that in the first week of going live, we collected 62% of that average monthly patient receipts, that client had seen the light and the direction we were heading, giving us full opportunity to prove our concept. We are also happy to say that the patient experience has also improved. Since introduction of this software, we have seen a growth rate of 200%, and the revenue has steadily increased.
Awesome. Thanks, Vince. So now we're going to talk about another practice. So what's specific about this practice is like the previous practice that Vince was speaking about. So this practice actually went from paper statements to an e-notification process prior to coming on board with Coronis Health. So this was a decently sized practice with 10 providers, and their specialty was pain management, and they're seeing these patients on a more frequent basis. So they kind of had already made the shift prior to coming to us. So when they came on board with us, what we decided to do is we were reviewing their financial policy. We wanted to check what their current e-notification process was, and including the verbiage on those e-statements. So like Vince had mentioned before, you can implement the system and we can roll out the e-notifications, but if you're not clear and don't have concise language and or your system's not set up to be optimized, then you may have some holes in the system. And that's exactly what we found with this practice. So based off of our current task analysis and taking a look from the full revenue cycle, what we were able to implement was an improved workflow and cadence for e-notification. So you'll see based off of this graph, in October, we started working with this client in middle of August. And in October, when we did a deep dive into their practice settings for their e-statements, what we realized was the e-statements were not capturing all of their business. And so they had a specific rule that was set up that was not actually pulling in every single statement. And so what we did is we adjusted that rule, updated the verbiage on the e-statements, and sent out the statements. And as you can see, going into November, they had a huge spike in patient payments because we were able to capture those patients that they weren't capturing before. Then we had a steady downtrend going into December because we're at the end of the year, so there's not as much patient responsibility, et cetera. And then you see going into deductible season, going into January, February, and then taking off into March, we saw a steady increase in their patient receivables, so much that within 3 months, we were able to see a 300% increase in their patient receivables just by taking a look at the systems and making sure everything in place was correct. So keys to client success that we found implementing both the e-statements and e-notification process is, one, most of these practices that we're working with, we view our partnership with them as a partnership. So it's not us as the billing company and them as the practice, but we actually view them as a partnership. We want to do a deep dive into the practice in order to further understand, one, and I think this is the thing that comes up a lot with patient receivables, is you have to understand a practice's culture and kind of what their expectations, what they're setting in place for their patients. And we want to be able to mimic that on the back end, because that is a part of the patient engagement during coming to see you as a provider. And so we do view this as a partnership, and both of these practices and the practices that we're working with view us as a partnership as well. If you had a chance to watch our webinar with our partner McKesson, we talked about systems optimization and maximizing efficiency. And so as you can see on the second point, we talked about implementing a system is step one. So yes, that practice that I just talked about was actually already had the e-notification process in place. However, they just had the system in place and they didn't have anybody actually monitoring the system and making sure that all of the workflow and processes that they had in place were actually capturing all of their data. And so you want to make sure along with that, that you're capturing all the data, you're capturing all of your patients, and that it fits for your company. And then also, we just wanted to share a quote from one of the clients from the case study, just kind of what we were able to do for them and to kind of help ease their stress when it comes to both revenue cycle and patient statements. So based off of this information, you may be thinking, what questions should I even be asking when it comes to patient statements? Like Vince had mentioned, most of our practices, your focus is on that insurance portion of your business because that makes up anywhere between 70 to 80% of your business. However, the patient receivables make up anywhere between 20 or 30% of your business. And actually, Vince and I were just doing a task analysis on a new practice that we're looking at, and their patient receivables actually make up 50% of their business because they didn't have different systems put in place. So we put together just some questions to start asking. So what does our patient AR look like? Do you have a good visibility on what the overall patient AR looks like? And where do you see your AR growing? What is your current patient statement process? What does that cadence of your patient statements look like? Is the current process reportable? So this is one thing we talk about all the time at Coronis, that we want to be able to provide analytics to our practices, and we have, built out all of these different tools for the insurance side of the business. But that patient AR has always been something that's been challenging to report on because we're relying on snail mail in order to deliver all of these patient statements. And so one of the things that we have been able to identify with some of our partners that we work with in the software technology space for e-statements is being able to report on how many statements we have sent out to patients. And so you can clearly see that, yes, you don't have to rely on the paper statement going out, but you can see that that e-text or that e-email actually has made it to the patient. What is our over 120 AR and who manages the next steps? So this is another piece, and this is not something we're getting on in this conversation, but this is the next piece that we see quite often is you send paper statement after paper statement after paper statement. You follow that 3-statement, 4-statement process, depending on what your practice is currently doing. And then all of that money falls in that over 120. And unless somebody's managing kind of what that next steps are, it typically just sits there. Are we optimizing our workflow to collect patient receivables? So are you actually taking a look at what does it look like on that patient registration process? Is that patient understanding kind of what their expectations are once that patient statement comes out? And then what does your workflow look like for patient receivables? Are you collecting time of service payments? What does that look like? Are you collecting deductibles and copays? And how are you managing those time of service payments? What is your current merchant service fee cost? I think this is something we get quite often when we're onboarding clients and talking about patient receivables and collecting money. Kind of what merchant service are you working with? And then what does that fee cost? Because it seems it can add up, but then do you know what your paper statement costs? Do you know what postage costs? Do you know what those return addresses cost, et cetera? Does your time of service payments and statement payments talk to your practice management system? So we see this quite often where, especially kind of, and Vince mentioned this in healthcare, we're seeing, we always kind of joke, but it's kind of a common theme that we see in healthcare. When it comes to technology, healthcare seems to be kind of behind the 8 ball compared to some of other organizations. And so what we want is for your practice management system and however you're collecting those statements to be talking to each other so that they post. So once you receive that payment, it's automatically posted in your system. So that's going into integrations and making sure that all of your systems talk. That just kind of removes that human error. And like Vince mentioned before, when he was showing you guys the difference between a paper statement versus an e-statement, especially when the systems talk in an e-statement, then those payments are posted next day. And then are you leaving patient receivables on the table because you are relying on paper statements? This is a common question that we ask most practices. And again, kind of going back to all of the other questions we talked about, it's one that's hard to answer because it's hard to report on those paper statements. And again, you're relying on a lot of outside forces that you don't have full visibility on. So based off of all of our conversations today, kind of what can Coronis do for you? What do you need to take a look at? So we just put together kind of a visual of what we look at when we are onboarding onboarding clients, and what we look at for the patient registration process. So a lot of these you're going to see based off of each section kind of fall into those similar initial questions that we just reviewed. So we go over your systems, we're looking at your statement vendor, we're looking at your practice management system, and we're looking at your merchant service. We also look at patient registration. That is a critical key to not only the patient statement process, but what we tell all of our clients, that patient registration and that first point of contact with your patient, that's when revenue cycle actually begins, because that's when you're taking up that patient's demographics. That's when you're getting their insurance information. That's when you're introducing them to your culture and really kind of understanding them as a patient. And so we really look at that patient registration process. And what are you collecting? What are patients signing? What is the verbiage that your front desk is using at that point of registration? And then we look at current processes. So what do you have in place as far as your current statement processes? Do you have payment rules in place? Do you have any specific rules in place where if a patient can't pay a bill, kind of what does that look like? We also take a look and a deep dive into your current patient AR. What's old and what's probably not collectible versus what is still on your books that we can collect. And then we start to put together goals. So looking at those financial agreements, talking about credit card on file, e-statements, improving the patient experience, and cash flow. So I will tell you, Vince and I were actually just talking this morning before the webinar and just kind of talking through the paper statement process versus the e-statement process. And as we were talking, I was like, oh, I just got a notification that I have a bill for my daughter for her last visit that she went to see the doctor at. So then I was able to very quickly go, all right, I'm going to go online, pay that bill really quickly, and I'm not going to have to worry about it. Like Vince said, I'm the same way. We receive paper statements in the mail. It goes on our table. I'm going to get to it on the weekend when I finally have time, and then the office is closed. So if I have a question, I can't follow up. And so it is just where our society is moving, and kind of just being able to have that immediate response, immediate answer. Whereas with these e-statements that we're talking about, you can text, you can follow up right there based off your phone, and you're going to get that immediate response. And on that note, I'm going to hand it back over to Risa for a Q&A.
Great. Thank you so much, Vince and Abby. That was a lot of really useful information. So at this time, I know some of you joined after my initial spiel, but at this time, if you have any questions, please enter them into the Q&A. We have a number already there, and we're going to try and get through as many as we can. So anything you would like to ask, please do. Also, we have our contact information up on the screen right now. So I'd love if you want to take a screenshot so that we can remove this in a few minutes. You can see Abby and Vince a little bit more while they're answering your questions. All right, so let's get started. So this is always a big question, I know. What about elderly patients? They don't use text or email. I have so many Medicare patients.
Yeah, I mean, I could take that one. So utilizing our platform, we would set up a billing cycle rule based on age. If the patient age is of 75 or greater, without an actual caregiver or a guarantor, that actual statement would immediately drop to paper. So we can set up those kind of rules and templates. We selected an age of 75. We can always adjust that however the practice sees fit. But just speaking from experience, my father's 69 years old, and he's still utilizing his cell phone more than I actually do. So that's probably our best practice for this time. We do like the fact that we always work with the providers, trying to actually make sure that there's an actual caregiver on file. At that point in time, we can always initiate an electronic statement.
Got it. All right. So Abby, if you want to unshare, so you can see a little bit more. Okay, so here we go. So based on the case study, which EMR or what EMR was being used and what type of company was it? Anything you're allowed to share.
Yeah, so the first case study was Cario, and then the second case study was Athena. But we do work with we're on 25 different platforms. So we work with various different platforms as far as EMRs and PMs go. And then I will say the one thing that we do on our end when it comes to, because we're on the 25 different softwares and we were talking about, does your system talk to your PM system? Our biggest concern is trying to find out like what is that best option for you. So we've vetted quite a few different sources that we utilize.
Great, thank you. Before we get to the next question, I actually have a little poll that I'd love, just so we can make sure we're all on the same page and we know who we're speaking with. So if you guys could answer this poll right now that you see on the screen, that would be great. For those of you calling in, you might not be able to, but those of you that are here, did it come up? Do you guys all see it? I hope so. All right, now people are starting to answer. All right, so just give a couple more seconds for you guys to answer, and then a lot of good questions coming in. We'll make sure to get to all of them. All right, last chance. Only a couple of you are taking our little poll, but that's okay. All right, so from the people that took the poll, oh wait, a couple more are taking it now. I'll wait a minute. It seems most of you are still using paper statements, not a hybrid model. Most people are only paper. It also seems we have mostly specialized physicians, non-surgical, but also a couple primary care and a couple surgical. And most of you are not current Coronis providers, so you might not know that much about us. All right, so I'll close this down. All right, so let's get to the next question. So for an e-payment platform, how do you interface with PayPal, et cetera, and then post to a practice management system?
Vince, do you want to take that one?
Sure. So we interface with a lot of different actual softwares, and that would be just something that we'd have to look upon to find out how we can actually interface, and it might take a little bit of time to realize that integration. But that's typically what we're doing right now with our PM systems, is we're integrating into those, and that's how we're utilizing and making that work.
Got it. Okay, great. All right, here's another question. What if you come across patients that have the wrong contact information? Maybe they change their information. What is the process for that?
So yeah, actually, that first case study, that was a great actual part for this, because in that, one of the big issues that we actually were facing was the fact that a lot of people move. Not so many people actually change their cell phones or email addresses. So that's actually what increased that revenue, because we were able to contact and reach out to them via that way. Now, as far as when cell phones get changed, things like that, again, you're working on 3 different notification processes. So based on just the fact that you're sending those 3, one of them are going to hit. So we do have the opportunity to easily change any kind of information. So let's say a cell phone doesn't go through, but an email does. We can alter that statement cycle immediately when that patient reaches back out to them or reaches back out to us. We can then contact them and get the actual adequate information.
Got it. All right, so here's a good one. So any pushback from patients that are getting accustomed to getting a monthly statement, they're now getting multiple e-statements in a month?
Yeah, so as Vince mentioned in that very first one, that is something that actually that came up from the provider. So patients started to complain because they were receiving these multiple statements, and we actually have documentation that's put together that talks to the providers and to the client kind of what to expect in those first 30 to 60 days. So obviously we're implementing a process change, and it's a process change that the individual patients may not be used to. So we have a guide of kind of how to handle that. We work with the front desk on kind of what those expectations are. And then also on our e-notifications that we're sending out to the patients, we can customize those based off of practices. So we've done that with quite a few of our behavioral health groups, because they have very specific language that they would like to use with their patients. And so we work with the patients to kind of better understand their culture and what that's going to look like. And then we put more explanation in there for the patients to better understand. And then the other piece is if they do have a question or they ask like, hey, I've already received 3 notifications from you. I have a question about my bill. We can answer it right then. Or if they'd like to receive a paper statement, we can drop it to paper statement for them.
Got it. Okay, so here's another good one. So curious as to what kind of cost reductions in total were realized by the practices when they went to electronic statements compared to the paper statements.
Yeah, I mean, obviously it's all dependent on volume. Your typical statement, paper statement is going to cost about 71 cents, which doesn't seem like much, but depending on your volume, it could obviously, go get up pretty quickly. So as far as that goes, if you just look at it, we're basically, with e-notifications, we're seeing pretty close to about an 80% drop off. So that way you're already minimizing, as long as you're getting that demographic information that's required, such as cell phone and email, it's going to drop off that paper statement cycle. And not only are you saving on the whole paper statement cost of it, you're actually saving on the whole manual intervention of it as well, which that's going to be internal staff.
Yeah, absolutely. All right, so here's a great question. During the pandemic, what did you see happen with paper statements?
Yeah, no, that's a great question. So I'm sure we can all relate during the pandemic and even post-pandemic. I think we're still feeling some of this, but the USPS, slowed down to super slow, and we were starting to see where, in certain areas statements weren't going out, and just you were still relying, especially with a lot of our practices, still relying kind of on that. They're used to patients coming into their office and bringing those paper documents, and here's our registration, and getting all of that information and collecting the credit card and insurance card up front. And so what we worked on very quickly during the pandemic were not only, and we're calling them contactless tools, but not only on the patient statement process, but on the patient registration process, and kind of what those contactless options were that are out there, so that we could help our practices kind of pivot during the pandemic. And then because we have a lot of practices that were doing telehealth at the time and still are doing telehealth, the e-statement and that contactless patient registration has been very helpful for them.
Got it. That's helpful. All right, so here's a big question. What is the cost for these kind of services?
Yeah, so that's a really great question. So it varies, like Vince said, when it comes to size and kind of volume. So if we are doing your full revenue cycle, this falls within, like we were talking about earlier for Coronis Health, this falls within your revenue cycle, cost. And so we work with, based off of the softwares and kind of what's available. To some of our practices, we're able to do it with little to minimal cost. And then some of our practices, based off of their software, that kind of varies. But again, we do a full analysis and we can give you guys full feedback on why it may cost the way it does cost.
Got it. Okay. So I know we already answered the question about older Medicare patients, but can we just directly, have you seen this be successful with these older patients that are Medicare? They think they want paper statements. Has this been successful to kind of transition them?
Yeah, so we've seen it with multiple groups who take primarily Medicare. The one area that we're still kind of working with different vendors and kind of making sure that it fits better is in the nursing home space, just because you're relying so much on the intake of the nursing home to get the correct information for us in order to be able to bill it out. We do see in a lot of our predominantly Medicare space that if there is the guarantor, prefers the e-statement. But then again, Vince and I were also talking about this as well. Both of our parents and grandparents are on iPhones and, honestly know how to use them sometimes better than what we do. So it is kind of, I think initially it was something that a lot of practices were like, we are predominantly Medicare, so we don't think it's going to work, but we've seen huge success for a lot of our practices that do have a high Medicare population.
Got it. I agree. My grandma's on email too. You're right.
Yep. Yep.
So what do you consider best practice for how often to send out an e-statement?
Again, it varies, kind of what we've been just discussing. You know, demographics, things like that. But we like to definitely send out as many notifications as possible without being deemed harassing. The more notifications, better. So we like to do it between a 3 to 6 day period where we're sending typical ones throughout.
Okay, great. And
I think just to go off of that, Risa, because I think a common question we're getting is, and I'm hoping that everybody's kind of feeling this coming through with the presentation. The one thing that we really pride ourselves at Coronis on is we know where our best practices are, we know what our solutions are, but we don't try to fit a square in a circle. So we know that, you know, different practices, different sizes, different geographical areas, whether it's rural versus urban, we take all of that into context when we're working with practices. And so that's why it's super critical to kind of do a full task analysis from front to end to understand all of your processes so that we can help you set it up to optimize for your practice specifically. And we can share our best practices, but we obviously know that it's not one thing fits everybody.
the continual operational improvements over time. And we're also using AI to also see what's going to work best and continue to refine it over time, right? It's pretty cool. So how do you feel about collecting payments up front at the time of service?
Great. So, I mean, obviously, it's a partnership, and that's what we want. We want to work on that. We work with the providers, and obviously, to do that. The thing about that is, you know, we actually had a statistic earlier in the slide where 60% of those are going to be, that the patient responsibility is usually going to fall where it's going to be after the time of service. If we can combat that and collect up front, sometimes that does work through a refund process that needs to be put into place, things like that as well. But, you know, eligibility pieces, if your practice has something like that, we definitely recommend it, obviously, to collect those payments up front, co-pays, things like that. But again, knowing that with deductibles, you can't always just keep track of them. There's no easy way to do that. So you're going to end up getting into the point where you're going to have balances that are going to fall to a statement level or in the back end.
Got it. So here's a really good question. What about patients that don't speak English or not great English to send out a statement? Yeah, so again, same thing. We can actually work with our platform and create different templates. We can actually create rules and things like that actually, depending on what language it is, we can build out a template for that and associate it by putting a tag on that patient so that that way they receive those type of notifications. Again, because it is actually being, you know, a message being sent, they do have time to actually look it over and review it. So that obviously provides a timeline instead of somebody reaching out and just trying to speak with them, where they can actually go through it and review what is actually being sent to them. However, as I mentioned, we can definitely put like tags into place where an individual can receive a certain notification based on their language. That's great, really helpful. All right, so before I get to the last few questions here, if anyone else, this is your last chance to pop them in the Q&A. We have Abby and Vince here at your disposal, so ask anything you'd like to. This is the time. So last two questions. So what's the length of time to implement a click-to-pay e-statement option if I want to move forward with something like this?
Yeah, so there's a couple parts to that. So depending on, like we said, we want to do during our onboarding process for coming on board, we're doing a full analysis of your full revenue cycle. And so typically for onboarding for actual revenue cycle, we're doing it between 15 to 30 days. And during that time, Vince is working very closely with you on setting up your e-statement or click to pay options. Again, your software does play a role into that. So we analyze your software and kind of what's available. With some of our practice management systems to softwares, we can set it up as quickly we've set it up as quickly as like 2 to 3 hours. Again, that depends on if you're collecting all that patient different demographic information, and we have that. Some of our other practices have taken a little bit longer. So again, it just kind of depends on your practice and what's available to us.
Got it. All right. And last question here. I'm sure everyone watching, we all know we have lots of patients that like to vent and complain online. And a lot of those online reviews often are about billing. So although we can't, change the, statement of benefits and all the confusing things that insurance companies send in the mail, can Abby and Vince, do you think that moving to these electronic statements has helped make patients happier or improved patient satisfaction overall?
100%.
Yeah. Go ahead, Vince.
Yep. Nope. Just the patient experience. Having that click to pay, all the information is right there in front of you in your hand. It's a great tool to have. If a person actually wants to be able to generate an actual paper statement, they can do that as well. So even the texting options, like I said, it's just all that information is right there in the palm of your hand. So for one patient, it's very transparent. The patient's getting the information offhand and right away. So it's in my mind, it's 100% better of what we've been doing previously.
Yeah, and I think depending on there's there's all different softwares right now that are kind of doing those e-statements. We work with a few that, like Vince mentioned, we like the fact that a patient can respond to the text or email immediately, and then on the backside get an employee of ours to respond and kind of give them more information. There are some that are out there where you can just kind of go online to the portal and then you can just pay on the portal right there. So if you do have a question, you still have to call. So there's different variations that are out there, but we really like the full scope where we can have the full patient experience right there via text or email.
I love that. So not only can we reduce some costs from all the paper statements and hopefully drive revenue by getting you paid, but we also might be able to even improve your online reputation and your patient experience, which leads to word of mouth and revenue far beyond what we could even claim to be from Coronis. Okay, last minute question just came in. Can e-payments be set up for vendors, such as if doing occupational medicine visits and a company may be paying on multiple accounts or patients?
Set up for vendors. Vince, you want to take that?
I'm not fully positive on what the question is. Obviously, we can alter it where we can take multiple different ones, different papers. Let's see here, paying on multiple accounts. So I'm not sure if it's referring to like a guarantor where a patient has multiple patients, but most definitely that could be set up for individuals such as that. That's the best that I think I can decipher that question.
Yeah.
And do you have any idea?
And if they're thinking, I don't know if with occupational medicine, like if you're thinking like the employer or having kind of a second like guarantor set up, but yeah, like Vince said, so this kind of goes off of what you're talking about. So I'm not sure. So I'm going to give this example and hopefully this answers your question. But in the pediatric space, if a parent has multiple kids that go to the same pediatrician, we do have the option to set up each statement under that specific guarantor. So that guarantor, if you have, say, 3 kids that are going to go to the doctor on the same day and you're going to get a statement for each one, then we can set it up where you're going to receive, like you'll receive a text message for each of those kids, but it'll all kind of be under the same one. So I'm not sure if that's the exact question you're asking. And if it's not, we can follow up after.
Oh, yeah. Here's some more information. So like the guarantor is the HR department for a company, and they make payment on behalf of up to 150 employees that we may do drug screenings for. It is sent as statements to the HR department.
Then yes. Yep.
Great. So it sounds like the name of the game is customization, and it sounds like we can pretty much do almost anything depending on your unique practice needs and even what your patients are asking for or what they want. So that's great. So if anyone has other further questions, we definitely invite you to reach out to Coronis, Abby, Vince, or we put Barry's email on there. They can all help answer some specific questions. No strings attached. We're here to help, and we want to be a resource for you. So with that, I really thank you all for tuning in to our webinar today. Thank you so much, Abby and Vince, for sharing some of these trade secrets and knowledge. This is recorded, so we'll send each of you the recording, and you can feel free to share it with any colleagues or friends that you think might find it useful. And otherwise, I hope this shed a little bit of light about the wonderful world of e-statements and how it can help you generate more revenue for your practice. So thank you all so much and have a great day.
Bye.